So for many folks in the trans and non-binary community, dealing with monthly bleeding can be really tough. It can cause significant dysphoria, that feeling that something's just out of sync with your gender identity. It's a very personal thing, and it brings up a big question. What can actually be done about it safely, effectively? Today, we're diving into the different ways to stop, delay, or maybe just lighten monthly bleeding based on the sources you've shared.
Exactly. And I think what's interesting here is that it goes beyond just, managing a biological thing. It's really about exploring personal agency, feeling more in control of your own body. And there are quite a few options, different approaches people can take to feel more comfortable and aligned.
Okay, let's get into that. The core reason, the why we're talking about this is pretty clear. For some trans, non-binary, or gender-diverse people, that monthly cycle is a major source of dysphoria. It's not just physical, it's emotional, psychological.
Mm.
It impacts daily life.
hmm And that naturally leads people to ask, okay, but is it actually safe to stop my period? Huh? And, what's really interesting is that the research, the studies have consistently found, well, no known risks associated with stopping bleeding itself. There's this common myth that blood somehow builds up inside if you stop your period, but that's just not how it works. The medications we'll talk about actually prevent the uterine lining from building up and shedding in the first place. So, yeah, debunking that myth is pretty important. It lets people consider options without that unnecessary fear.
That's a really key piece of info. But like with most meds, there can be side effects, right, for
Yeah.
some methods. Things like maybe a higher risk of blood clots with certain hormones, or some methods aren't recommended for super long-term use.
That's right.
So the critical thing really is talking it through with a doctor, understanding those specific risks for you. Okay, so where does the conversation usually start for many people seeking masculinization? Often it's masculinizing hormone therapy, right? Using testosterone as part of GAHT, it seems like that's often the first, maybe most desired
Mm.
method for stopping periods for those taking T.
Yeah.
How does it actually, work to do that?
Well, if you think about how hormones signal things in the body, testosterone basically tells your pituitary gland to chill out. It suppresses the production of LH and FSH, that's luteinizing and follicle-stimulating hormone. These are the hormones that normally trigger ovulation and then menstruation. So by suppressing them, testosterone usually suppresses ovulation, and then the period stops. It can also cause changes in the uterus and ovaries over time, too.
Right, okay, so it's interrupting that hormonal cascade.
Yeah.
What does that look like timeline-wise for someone starting T? How quickly do periods tend to stop?
The sources suggest it's pretty effective for many, about 3 out of 4 people, so 75% find their periods stop within the first 6 months, which is often a really welcome change, obviously.
Yeah, 75% is a good number. But
Yeah.
what about that other group, the just under 1 in 4, the 25%? What's their experience?
And that's where the nuance comes in, yeah. For that group, it might take longer than 6 months, or they might continue to have some regular bleeding, or maybe spotting what's often called breakthrough bleeding, even after they've been on T for years. So it's really important for people to know it's not like a guaranteed outcome for absolutely everyone.
Okay, that's good to manage expectations.
And crucially, this is so important, testosterone is not a reliable form of birth control. Pregnancy can definitely still happen. So talking about effective contraception with a healthcare provider is, well, it's essential.
Absolutely vital. Okay, so navigating those expectations is key. Now, what if someone is on testosterone and their periods just keep happening? What might be influencing that? What are the next steps?
Yeah, good question. There are a few factors that the sources point to. The type of testosterone might play a role. Sometimes gels or creams like Testagel, Testovan, Under Forte, they might take a bit longer to stop periods compared to injections like Premotestin or Reandron. It's not a hard and fast rule, but it's something that's observed.
Yeah.
Also, the testosterone levels themselves, if levels are maybe a bit too low, that could contribute. But interestingly, it's not always about just cranking the dose higher, because if testosterone levels get too high, the body can actually convert some of it back into estrogen.
Oh, really?
Yeah, which could kind of counteract the goal of starving periods. It's like the body trying to find a balance.
Wow, okay. That's fascinating, that conversion thing. So for someone whose periods are persisting, what kinds of things would a doctor ask? What might they look into?
Well, first, it's worth remembering that not all bleeding is necessarily a period. Sometimes it can be from dryness or thinning of the vaginal lining atrophy, which can happen with testosterone. So a doctor might ask about, any changes since starting T, how long you've been on it, the type and frequency you use. Also, Other medications, your cervical screening history, any recent surgeries, signs of atrophy, even stress levels can sometimes play a part.
Mm,
And in terms of investigations, they might do blood tests to check hormone levels or maybe a pelvic ultrasound. And there are options like transvaginal or transabdominal, depending on what feels okay for the person, trying to minimize dysphoria.
okay, that makes sense. And once they have a better picture, what adjustments might a doctor actually suggest for the testosterone itself?
Right. So based on all that info, they might suggest switching the type maybe from gels to injections if periods aren't stopping, or adjusting the dose, making sure it's not too low, but also not so high that it's causing that estrogen conversion we talked about.
Got it.
They might even suggest changing the injection frequency, like maybe going from once a week to twice a week for some types of tea. It's all about trying to find that sweet spot for your specific body.
Okay, so lots of tweaking potentially with T. But what if T isn't the answer or isn't getting the job done completely? What other hormonal routes are there? You mentioned many are progesterone-based and might not mess with T effects, even some with estrogen.
Exactly. If we look at progesterone-only options first, there are several. There's the mini pill. You take it daily. It can make bleeding irregular at first, potentially, or stop it altogether. If you're relying on it for contraception, taking it at the same time each day is really key. It might cause more random spotting initially compared to combined pills, but that often settles.
Okay, daily pill. What else?
Then there's another progesterone-only pill called drospirenone. The brand name is Slind. Similar idea, daily pill. Again, for birth control, missing a dose needs backup. It might not stop bleeding right away for everyone, but the chances seem to go up the longer you use it.
Right. Are there longer-lasting progesterone options?
Yes. There are hormonal IUDs. These are small, T-shaped things placed inside the uterus. They last for anywhere from 3 to 8 years, depending on the type. They release progesterone locally and are often very effective at making bleeding much lighter or stopping it completely.
But the insertion.
Yeah, the insertion procedure needs a doctor, and it can be uncomfortable, sometimes painful, and for some people, the procedure itself could definitely trigger dysphoria, so that's a big consideration.
Mm-hmm.
Another option is the Depo-Provera injection, sometimes just called the shot. You get it every 3 months, usually in the arm or buttock. It uses a progesterone-like hormone, no estrogen. Pretty effective at stopping bleeding for many. Doctors usually advise against using it for more than 2 years, though, because of potential effects on bone density. Although, being on testosterone might actually help counteract that bone density concern.
Oh, interesting interaction.
Yeah, and some people find their bleeding comes back quite suddenly when they stop the shots.
Okay. And you mentioned implants.
Right. Hormonal implants, like Nexplanon, it's a tiny matchstick-sized rod that goes under the skin of your upper arm. Lasts for 3 to 5 years. Generally, putting it in is less uncomfortable than an IUD insertion for most people, and they're very effective, often stopping periods or just causing some light spotting.
Wow. Okay, quite a range of progesterone options there. Now, what about the ones that do contain estrogen, like the combined pill, the patch, or the ring? How do they work for stopping bleeding, especially if you use them continuously? And what about that concern people have about taking estrogen when they're also on T?
Yeah, so with those combined methods, the pill, patch, ring, the way to stop bleeding is usually to take the active doses continuously. You skip the placebo week or the week off. You might get some random spotting, especially in the first few months, but that usually settles down as your body adjusts.
Okay.
And that brings up the estrogen question, which is a really valid concern for people on testosterone. Some sources state that the amount of estrogen in these methods is actually tiny, far too small to affect any testosterone effects. But individual experiences can vary for sure. And not all doctors feel equally comfortable prescribing them in this context. Some people do report side effects they associate with the estrogen component, things like mood swings, maybe migraines, increased dysphoria, or concerns about blood clots, which are a known, though small, risk with estrogen.
Right. So definitely a conversation needed there, too.
Absolutely. It's about weighing the potential benefits against the potential risks and side effects for that individual.
Okay. So moving beyond hormones, for people looking for a more permanent solution, what about surgery?
Yes, surgical options are definitely on the table for a permanent end to periods. There are two main ones. First is a hysterectomy. That's the surgical removal of the uterus. It's permanent, it guarantees no more periods, but crucially, it also permanently means you cannot carry a pregnancy.
A very big decision, obviously.
A very big decision. The second main surgical option is endometrial ablation. This is a procedure where they destroy the lining of the uterus, the endometrium. The goal is to drastically reduce or completely stop menstrual flow. It's generally considered less invasive than a hysterectomy, often with a shorter recovery time. Though, online info about recovery experiences can sometimes be a bit mixed.
Right. And I imagine both of these surgeries involve really serious, in-depth discussions with a doctor, talking about all the risks, the benefits, making sure there's fully informed consent, especially around the irreversible impact on fertility.
Absolutely. Those conversations are critical. It's about understanding exactly what the procedure involves, the potential outcomes, the risks, and the long-term implications, especially regarding fertility.
So bringing this all together, what does this mean for you, the listener, navigating all this?
I think the main point is that there can be many reasons why bleeding might persist, even on testosterone. But just as importantly, there are also many potential solutions. Every single body is different, and how someone responds to any treatment can vary a lot. It really is about finding the path that works best for you and your personal journey.
Which is why it's just so vital to talk with a healthcare provider. Ideally, someone who really gets trans healthcare needs. They can help figure out the best approach for your specific health situation, your goals. And that includes having those important conversations about future fertility options too, if that's relevant for you.
Exactly.
So I guess the big takeaway from our deep dive today is, well, the journey to stopping monthly bleeding, if that's something you want or need as a trans or non-binary person, it's deeply personal. But there's a really wide spectrum of options out there, medical and surgical, that can be effective in helping find that comfort and alignment.
Yeah. And maybe a final thought to leave folks with, considering all these diverse, often very personal reasons someone might want to stop their periods and the different ways to achieve it, how might going through this process actually transform someone's relationship with their own body and their sense of self beyond just the physical change of not bleeding anymore?
It's a really powerful question to consider. We hope this deep dive gives you a good starting point for your own research, and especially for those important conversations with your healthcare providers. Definitely check out trans-affirming resources for more support too.